to go on to the next one, and I think our time might be a little bit more limited now, if that's okay with you.
Perfect.
Guys, any questions along on this topic of play? Nothing. We all know how to play. Thank you.
I think that's why I chose my profession. I think I haven't grown up yet, except my body and my eyes are telling me slightly differently. All right, I'm not going to go through a lot of the promo of this because it was covered in the first one, because from that scoping review, then we went on to systematic review, and it was COVID related. I couldn't do my original study that I proposed to do. All right, so what I wanted to do in this study was to examine evidence of play used in health promotion intervention with community dwelling adults and children originating from the continent of Africa, and to make recommendations for the future use of play as a health promotion tool. So the method, I'm going to skip the first part, that was the scoping review. And so from those 127 sources from the scoping review, we then applied a systematic review guidelines, which was a PRISMA systematic review guidelines we used Covidence tool and an external reviewer, an eligibility screening for the systematic review with sources with health promotion as an outcome, with play used as the intervention tool with participants from the continent of Africa. And we excluded play therapy, thinking it as it being as a more therapeutic technique. So the results, so 80 sources were initially excluded looking at the title and the abstract, and then 24 sources were excluded on full text evaluation, resulting in 23 sources where the data then was extracted, analyzed, and synthesized. Not surprising, mostly South African, and mixed to varied designs. Participants were varied ages, settings, and numbers. And what was really amazing about, I think why a lot of this was so effective, the intervention providers were multi-sectorial, and often there was collaboration in the planning and the implementation of a lot of the programs with participants in those communities. Health topics were wide-ranging, with diseases most addressed, but it was anything from, like I said, rural management of climate change, things looking at pain and palliative care, a whole list here. Diseases was most addressed, and obviously HIV/AIDS was the top, and then TB, malaria, parasitic diseases, bacterial diseases. Some of the health topics were more than one. Some people had 8 topics, medical health topics that they wanted to educate on. Palliative care, let me just see what the other one was. Okay. And then it also looked at, I'll come back to that when I remember it, it's over there. Right, the sources, I'm going to look at that. Amory, I'm not going to go through all of them, but just to highlight a few. Amory did one where because it was a computer program developed by Seagram, and the participants had to problem solve, and it was a realistically drawn up community in an African context, in a rural community. And then they had to address what was the biology of cancer, HIV/AIDS, what's the biology of that, what's the management of that? And then they had to come and problem solve about if this arose, what would you do kind of thing. And that was really engaged with, because it was a computer game for adolescents, of course they're going to want to enjoy it. One would think, why would children's poetry or oral poetry be a health positive outcome from a health promotion thing? Developed identity, a sense of belonging, allowed one to learn, developed your memory skills, allowed bonding. And those are really, really important post-COVID, particularly when you see people feeling very depressed and alienated, a lot of people. There was one, Fuller did 2 studies looking at football, and they looked at attached, that was the one with 8 messages. So they had health messages within the football game. And that was done in South Africa. And then the second one was South Africa, and Mauritius. Then the Scopely game was the one of the, it was a community ravaged by HIV/AIDS, where the women came together just to make dolls to raise money because their community was completely ravaged with not having an income with so many people with HIV/AIDS. And it provided, number one, a safe space to share, to understand. They brought in information about HIV/AIDS, and that sense of mourning and coming through and coming out as a very cohesive group at the end of it. Lachman's actually busy with a second parenting program, including play. Then Peterson, that was an interesting one. That was adolescents in a hall with different clear beakers with water in it. And they'd spiked some of them that when you added a reagent to change color. And they said to them, go around the room and just share your water with everybody. And at the end, they checked with the reagent. From the few that there were many. And that's how STDs and HIV/AIDS get spread. And the teenagers went, what? Lived experience, I won't forget this. I'm going to think twice. So that sense of developing, giving knowledge allows agency of making the right stop, make the right choice. Then there was, mid-micro fun with facts was most medical professionals, when they have to learn this terrible mid-micro facts, they did it like a Trivial Pursuit game, and they found, whoa, I really enjoyed this. I learned so much through that. Then there was a smartphone game, To Money, that was in Kenya, where they gave this to adolescents, and they wanted to try, the end outcome was, please don't have sex at an early age and please use a condom. And it was a smart, and Tumani means hope in Swahili. And they were only told to play for a certain amount of time. They played 20 times more. Their smartphones were intact when they were given back. They learned so much from it that they started sharing with their parents and their grandparents, so that it was that spread of information. So we've got to look at this as ways of transmitting information about health. So looking at risk of bias within individual sources, because we had such varied methodologies, it was very difficult to get a very rigorous tool to analyze this. So we used Johanna Briggs' critical appraisal checklist, and they all received an A grading, and that's just an example of cohort studies there. Measurement tools were varied, from interviews, round-robin discussions, very, very varied. And some assessments are used before and after, or in between. Follow-up periods range from 1 hour to 6 years. Participant attrition, I couldn't believe this when I saw this, because your biggest thing with research is lost to follow up. Why are we losing our participants in research? It was 86, almost 87% of people that did not withdraw. To follow up, and then you have to follow up is too much. They've forgotten. Other things have happened in life. Authors were university staff predominantly. Funding conflict of interest wasn't often described. I had to follow up on that. Sources were varied. Summary of the individual sources results. Positive outcomes were found in every source, and they numbered 14 when you collated those. And there was one negative outcome, that was Lachman's study, which was the parenting was not so great, but they felt that it was the iatrogenic effect of the assessment or the research study. Right, the health outcomes. Mostly positive emotions. Imagination, child studies, and mentioned at the end there. Using it, and that's understandable, because gameplay's got the longest range, because it goes from preschool right through to when you're very mature. And it's also very, for me, I think it's very easy to adapt, but most people can adapt a game. Playing a game with a child, you kind of smudge it so that they win sometimes, so their confidence doesn't drop. But you can take one idea like the Monopoly game, like a Riscopoly game, and there you have an amazing tool that people engage with quite readily. Next came dramatic play, like role play was a significant one. And the teenagers and adolescents who engaged, they said it was that lived experience, that I experienced that made me resonate, that resonated the best with me than someone just giving a talk or giving a pamphlet on STDs, for example. Then symbolic play came through, recreation, sensory motor. Construction, funny enough, was low down, so Lego, oh dear, and then whatever the child wanted was the last one. The confidence, the famous scale was applied. Was it feasible? Was it cost effective? Were resources available with sufficient experience or levels of competence there? Was it appropriate, culturally acceptable, transferable, applicable to a majority of the population, easily adaptable to a variety of circumstances? Was it meaningful? Was there positive and no negative experiences? Was it effective? Outcomes were positive and beneficial, and was it safe? And all of them received an A grading. Discussion, the influence of play as an interventional tool. Why? I mean, it resonates so well with me. I don't think I've grown up, but play is such a motivating tool because of the positive emotions it elicited. How many of you didn't experience positive emotions when I said think about play? It resonates with the majority of us. It was also the type of play that was chosen for that group of community, or that those participants was specific to what they would enjoy doing. And they really and cost effectiveness of play materials were often made with whatever they had. Obviously, the follow far-reaching cell phones. It's a compelling option to use. You can connect virtual community with. In 2020, they did a survey in sub-Saharan Africa. There were 535 million cell phone subscribers, and I think that's gone up. One of the sources mentioned 81% of adolescents have access or have a cell phone. So it's really well, I want to adapt it for my community or my health needs. Wide range of health promotion topics were followed, combining health topics. Very effective, gender-based violence work and adults, effective. And I think this is where working from home that COVID has taught us, is that you're getting a little bit more balance of play because you can do a little bit of that at your tea time instead of chatting with or going to, and having a smoke outside. You now engage with maybe your children if they were. Participatory approach that we're using, collaborative. So yeah, the sources were limited, unfortunately, mostly South African. We need to encourage publishing in other African universities. And it's a whole thing when you're on the floor and you're just putting out those fires. You've got such a workload. You're sitting on so much data, so much information you can share. And like, we problem solve. And then people come from overseas and, oh, we've done it. And we say, we've been doing that for years, but we haven't documented it. And we have so much to show. So I always think a collaboration between the universities. There are often people who don't know what they want to research. They just want to get their master's and their PhD, or the fourth year students don't know what to research. That collaborative approach from the communities on the ground. What do we need information of? What do we need help with? Let's research it. Let's get the data that we can get the funding. Only scale measurements were used. And unfortunately, that was just what was available in the research community at the time, but they are trying to address it. Strengths of the study, that Riga was strived for quantitatively and qualitatively, and both a combination of qualitative and quantitative data analysis was used. And I think that's what gives you richer information and more complete. Sources were representative of many sectors, and the benefit of play as an intervention tool in health promotion was effective. Reflecting play's diverse applications and oral comments. Limitations. Measurement tools, unfortunately, scales had to be used, only English published sources, and mostly from South Africa. Implications for future research. We need to include those from outside Southern Africa a lot more, and giving funding for the implementation and writing up of those health promotion programs. Record oral knowledge and perspectives originating from the continent of Africa. There's a group in Cape Town where they're actually recording stories and putting them into book form in different languages. And that's so amazing not to lose that valuable resource. And continue research across sectors. It's a collaborative approach, not just community and the health professionals, but within the health professionals as well across the board. And not just health, education, social, the whole group. Address pertinent health issues. So COVID's kind of going away, but what else is predominantly going to come up now? Use a combination of traditional and current types of play as intervention tools, and use the participant collaborative approach for planning and implementation of health promotion programs. Translate questionnaires is a strong one that came through, and games and books used in health promotion into the participants' languages. There was one where they tried to introduce book reading in the maternity wards with the new babies. And the mothers, when the bell rang, they all had to pick up a book or sing a lullaby in their home language. And for half an hour, they just had, and that was to develop language skills in children, because the amount of language your child has by the age of 3 years will determine how far academically they will go. So there's been a strong push on that. More credible research. People are not actually clearly stating ethical approval, funding received, conflict of interest, timeframes of intervention. That was a bit annoying, because if you're going to replicate this, why didn't you say that? And timing of measurements. And in qualitative resources, the researchers should definitely situate themselves culturally and theoretically to look at bias. There was no funding or conflict of interest. And in conclusion, so play as a health promotion tool, it's feasible, it's meaningful, it's appropriate and effective. As play elicited positive emotions and was interactive, varied and adaptable, health promotion programs could benefit from using play as an intervention tool, and limited research from African countries outside of South Africa requires attention. Thank you.
Righto, ladies and gents, any questions regarding this lecture on play? That's quite a mouthful. I must say your methodology was actually quite on track and pinpoint. Well done.
It seems like play seems really, but it's important.
We really enjoyed it. Thank you so much.
Thank you.
Mush, tell me, have you got one lecture left?
No.
It's not yours, eh?
No.
Okay. Is he online? Okay. Is it Peter? Okay.